Right. Good afternoon. My name is Kathleen Clark. I'm the Commercial and Operations Manager at Labour List. I'm also a keen Fabian, which is why they've invited me here to speak to you lovely people. Thank you for coming out on a Saturday. It's brilliant to see such lovely faces staring back at me, and even though it's January, well done for getting out of your houses. So listen, we can sit here and talk about doom and gloom and how terrible things are, but what we've actually got here is a panel full of experts on the matter of discussion, which of course is health and care. I'm going to now ask them to introduce themselves one by one, very briefly, and then we will hear from one speaker in particular who I'm very excited. She's here. So I'm going to start. I'm going to do a Labour Party, a classic Labour Party. I'm going to start on the left and work right, and I'm going to ask the General Secretary of the Fabian.
Hello, everyone. I'm Andy Harrop, General Secretary, but for the purpose of this panel, I'm the author of the Fabian Society report, Support Guaranteed, the Roadmap to a National Care Service.
Hi, I'm Anita Charlesworth, and I work for a health charity called the Health Foundation. I'm a health economist, and I work a lot on the long-term challenges facing the health and care system.
Hi, my name's Abena Pongasari. I'm the Shadow Minister for Women's Health and Mental Health.
Hi, I'm Sonia Adisawa. I'm a GP. I campaign on mainly women's health, and I'm on the exec of the Fabian Society.
Brilliant, thank you. I think there might be a bit of a problem with Sonia's mic, but while we get that sorted, we're going to ask for Abena Pongasari to take the podium and to speak to us on a topic that she cares deeply about, women's health and mental health.
Hi, good morning, fellow Fabians. I'm proud to be a Fabian, and I'm also a member of the Fabian Women's Network. So I'm going to do a shout out to my sisters today. I want to speak today about Labour's plans to transform public health. First, let's acknowledge the Fabian Society's unique contribution to the health of the nation. In 1909, Beatrice Webb published the Minority Report to the Poor Law Commission. It was a direct assault on Victorian philosophy that to be poor was a personal choice and a personality flaw, and that poor could be divided into deserving and undeserving, and that the charitable middle classes should be the judges of who gets help and who didn't. A patronising attitude called out by Joe Priestley and Inspector's Calls. By contrast, Webb and the early Fabians made the argument that poverty was the product of an economic system, not personal flaws, and that social security should be provided by the state and not charity. Webb wrote in the Minority Report that the goal was to secure a national minimum of civilised life open to all alike. The Fabians produced a pamphlet before the Second World War calling for a socialised medicine and a nationalised health system. And of course, the 1945 manifesto, drafted by, you guess it, a Fabian, Michael Young, stated, by good faith and good homes, much avoidable ill health can be prevented. The best health services should be available for all. Money must no longer be the passport to the best treatment. Take a note of the emphasis on prevention of avoidable ill health, as well as the social justice about heartbeats running through those brief but powerful words. I'll talk more about that shortly. Healthcare provided the right of citizenship based on clinical need, not the ability to pay, remains the bedrock of Labour's approach. Our manifesto this year will be explicit. Labour is the party of the NHS, free at the point of need and available to all. With a workforce plan and investment in services to get the NHS off its knees. But what Keir and Wes and myself have been arguing robustly is that NHS is not sustainable. The model is not sustainable in the long term without radical reform on how to deliver public health. If you ask me to explain Labour's approach in a single word, it is this: prevention. Prevention must be our watchword. 20 years ago, Gordon Brown, as a Chancellor, commissioned Derek Draper the OneLess to review NHS investment for the next 20 years. The OneLess report led to the expansion of NHS capacity and workforce until 2010. When Labour last left office, public satisfaction with the NHS was at an all-time high. From 2001 to 2010, the proportion of people in Great Britain surveyed reported that satisfaction with the NHS was a peak 70%. Today, it is a mere 29%, at an all-time high under Labour and an all-time low under Tories. So don't let the Tories tell you any different. The OneLess report offered various scenarios, but the third was that the OneLess called the fully engaged scenario, and I quote, "People living longer and in better health with major improvements in public engagement with health, with people both taking much better care of their own health and making higher demands on services." Britain's failure to follow this course after 2010 is why the NHS is in such a terrible state. It is why we were so unprepared for the pandemic and why the NHS needs rescuing now. The truth is that NHS will never ever keep with our demand if the system is based on treating us when we are ill and not preventing us from getting ill in the first place. So that's why we've called for a massive shift towards prevention. Why is this so important? After 14 years of a wasted Tory government, the health of the nation is suffering. In January this year, Sir Michael Mormont, the great guru of public health, reported that 1 million people in England died prematurely in the decade after 2011 because of poverty, austerity, and COVID. The latest report shows that the stark economic and social inequalities means that poorer people are dying early from cancer, heart problems, and other diseases. We are a nation not divided not only by rich and poor, but sick as well. And if you're poor and black, at the intersection of these, your health and your well-being and your length of life is likely to be less than affluent white counterparts. There is no social injustice more cruel and heinous and yet preventable than the injustice of life expectancy. So, in the next Labour manifesto, we'll contain that pledge to tackle health inequalities in building our mission to create, and I quote, "a fairer Britain where everyone will live well for longer." Everyone lives well for longer, irrespective of income, race, class, or sex, no matter where you live or what family you were born into. Just like the 1945 manifesto, a few words, but a vast task and a worthy challenge. Let me give you concrete examples of Labour's preventative approach. You will see that in Keir Starmer's article in The Guardian about supervised business brushing of teeth in schools, the fact that the biggest reason that for 6 to 10-year-olds being admitted to hospital for tooth decay. So supervised toothbrushing is part of our child health plan. We'll start to reverse this. And as the British Dental Association Chair Eddie Crouch says, supervised brushing is a tried and tested policy that the government's own modelling shows pay for itself. Prevention isn't just a better than cure, it is cheaper too. And if we get accused of nanny statism, I would rather embrace that than see a single 7-year-old in A&E having their rotten tooth extracted. Let me address another part of our public health crisis, the crisis that is mental health. Mental health care in England, has become a national emergency according to the NHS Confederation. Care is stretched that thousands of people undergoing a mental health crisis are admitted every year to acute NHS hospitals. even though they are not set up to deal with them. It is a system stretched beyond breaking point. And I welcome my friend Luciana Berger on the cross-governmental mental health policy. One thing that the Fabians understand is that we cannot treat health of the nation in isolation from the social and economic determinants of health. We know that decisions such as transport, education, planning, work, tackling crime and antisocial behaviour, advertising, are all these things that affect health and well-being. The epidemic of looting from shops affects the mental health of shop workers. People with dangerous cladding on their blocks of their flats live with constant anxiety. Teens are living with cyberbullying and conspiracy theories online and harmful advertising targeted at the young. Millions are worried about their rents and mortgages and rising prices. People are doing free jobs on 0-hour contracts, never off, always on call. The tyranny of the mobile phone, the gig economy makes us ill and creates a fragile, anxious and brittle society. So we've asked Luciana to look across all our policies and join up our approach to mental health. Our national mission makes it clear that our goal is to embed long-term planning to ensure those in health, there is health in all our policies. This is entirely the right approach. You might know that the Labour government in the late 1970s commissioned Douglas Black to produce a report, and the subsequent Black report was presented to government. When it was reported in 1980, its central premises was poverty remains a chief cause of disease and its factor which is beyond the immediate control of medicine. No surprise that Thatcher ignored the Black report. Yet under Labour governments, with the reports from Donald Eckerson and Sir Michael Moment, we've established the link between the conditions that we live in and our health. Indeed, one of our actions the Labour government took that has the best outcome was the smoking ban, one of the most significant public health interventions alongside the building of sewers and clean water, the Clean Air Acts and the COVID vaccine rollout. These big things should inspire us to think big, and we need to be joined up across government, considering public health in every decision. Let me conclude in my 10 minutes on two areas that need particular and urgent attention from the Labour government. The first is Black maternal health. Our mission states that we will set explicit targets to end Black maternal mortality gap. Black women in the UK are 4 times more likely to die whilst pregnant giving birth as new mothers than white women. That is absolutely unacceptable. Labour will recruit more midwives and health visitors, incentivise continuity of care and improve training course content in the presentation of illness amongst different groups. This public health issue is entirely unrecognised and not understood by Beatrice Webb or Nine Bevan or the founders of the NHS, which nevertheless requires our values of social justice to be applied. Black people experience racism within the NHS as patients and as workers within the NHS, even though the Black contribution to the NHS is huge. I'm thinking of the Windrush generation, of course. I'm thinking of the pioneers before, alongside the Windrush generation. People like Desert Bell, Matilda Asante, born in 1927 in Accra, Ghana, arriving at Dover in August 1947, before the NHS even started, and became a qualified nurse at the Central Middlesex Hospital in Harlesden, northwest London. The history of the NHS and the Black history are entwined so closely, yet racism in the NHS still persists. Black maternal health is an issue that requires specific action and targets, not warm words, including challenging racism within the NHS itself. If I'm lucky to serve as a Labour Minister, this is an example of a difference I want to make. The second big priority is mental health and young people. The young generation is entering adulthood with poor mental health, exacerbated by COVID and accelerated by a range of factors, including social media. My father was an NHS mental health worker for many years, and my mother was an NHS nurse working in mental health. They say it's never been as bad as it is today. That's why I'm so proud Labour will tackle the crisis in children and young people's mental health services by cutting waiting lists, by recruiting thousands more staff, introducing specialist support for children and young people in every school, and delivering an open access children and young people's mental health hub for every community. And we will pay for it by abolishing tax loopholes for private equity fund managers and tax breaks for private schools. Children's mental health before tax breaks for Eton and Harrow. This is Labour's social justice mission. This is the Fabianism in action. This is the Fabians the Fabians was not always right about everything, and we must acknowledge that shameful diversion of some Fabians into Eurogenics and some Fabians pro-colonialism and racism. But on this big one, the health of the nation, we can rightly and justly be proud. Ideas into action, plans into power. But before your questions and comments, let me assure you that the next Labour government will not only build on our proud history, but also embrace modern technology by adopting new technology, by liberating our citizens from preventing disease and poor health, and let the next generation grow tall. Thank you.
Amazing. Thank you very much. Also, I know, just to pick up on a point, to pay tribute to Derek Draper, who started Labour List as well. So nice that we both picked up on that. Really interesting points made. I'm now going to swing over to my left and ask Andrew to make a very brief opening statement.
Hello, everyone. So, about 18 months ago, the Fabian Society was delighted to be asked by Wes Streeting and the trade union Unison to do a review for the party and for Unison on what should the path to a national care service look like. We published our report last summer, and some elements of it have been adopted already by the Labour Party. And I just want to run you through some of the key things that we're proposing in terms of a real transformation in adult social care. At the moment, we have a care sector where the workforce goes under-rewarded, under-acknowledged, under-supported, and no surprise, we have a huge recruitment crisis. We propose to have a new national workforce settlement. So whoever is employed, or whoever your employer is, and there are over 10,000 social care employers, there's a single minimum set of terms and conditions and pay standards. It will be negotiated as a national fair pay agreement. And over time, as further reforms happen, moving towards parity with the NHS, where you have two people doing very similar work in the care sector and the healthcare sector, they should have very similar pay, conditions and terms. The second thing that we talked about was a more national service. This does not mean that local government would play a massive and essential part in coordinating, commissioning and delivering social care. But at the moment, we have chaos. Local government has all the responsibilities without having the resources or the powers they need to deliver good social care. So our proposal is that there should be national responsibilities for the Secretary of State, just like he or she has with the NHS, to ensure nationally consistent, high-quality adult social care across all of England. And that would come with new functions and responsibilities at the heart of government, including on workforce, as I've already talked about, but also finance and the quality and innovation of services. That links to a perennial problem with many public services, but particularly social care, which is geographic variability. At the moment, what you get in different parts of the country varies wildly, and there are some reasons which is about choices and democracy, fair enough, but an awful lot of that is about a financial system that has huge mismatches between the resources some parts of the country have compared to their levels of need. And we need to reopen how we distribute the money for adult social care, to split it out from the rest of local government and have a clear national formula and a national grant, so that wherever you live, your local authority commissioner will be able to ensure you have good quality support that you need. The fifth thing that we call for in this report is a move away from the chaos, the sort of, the fragmentation of the system, which is basically a market-based system where you have thousands of providers who are purchased from local authorities in a way that doesn't give any consistency and long-termism. So rather than having a system where there's an awful lot of public money being spent, but through unplanned markets, sometimes through exploitative, poor practice providers, that we have a long-term partnership. So there would still be independent provision, but it wouldn't be through short-term contracts, but it would be through a long-term managed partnership with everyone in a community coming together to plan and deliver local social care services, as is very familiar in many other parts of the public sector. We then say that this service should be for everyone. At the moment, we have a two-tier social care system. We have a means-tested system for those without much resource, and we have a do-it-yourself system for people who may have money but don't have the support or knowledge to be able to find themselves good services. Whoever's paying for social care, we argue it should be the public sector that is commissioning and organising and hand-holding people so that they get the right support that they need. All of this requires money, and this will be the area that is most challenging for an incoming Labour government. We know how tough the financial constraints are going to be on a new government. There won't be a sudden cash injection into social care of the scale that is arguably needed, but we can't go on having short-term bailouts and emergency cash injections, which is what we've seen over the last few years. We instead need a long-term financial commitment where, even if it doesn't start as a lot, that the government says year after year we are going to carry on investing more into social care, and that will give certainty for providers and commissioners to plan better services, to invest in better facilities, knowing that there is a 10-year financial settlement for social care. Now, many people would like that to include people paying less out of their own pocket and the government paying more when it comes to those with some means, with assets and incomes. I think that that is a brilliant long-term aspiration, but there is so much else wrong with social care that is not the first thing a Labour government should do. So we should set aside all the debates about DILNOT, free personal care, that have been sort of front and centre in social care, and say we will come to those. They are important, but until we fix the social care system as it is today, there's no point in having a conversation about fairer charging, because at the moment, fairer charging for what? It is a service that is failing to deliver for anyone. Thank you very much.
Amazing. Brilliant there to hear from an experienced politician and also somebody who's worked in the care sector before about realistic expectations in the future. And I think we've obviously got the optimism of hopefully a new government, but then also combined with the realistic expectations of, when we open the books, what on earth are we going to be looking at? And just to pass that over now to Anita, who will speak and give her opening remarks.
Yeah, and I was thrilled that the Shadow Minister talked about the Oneness review, because 20 years ago I had the great privilege of leading the team that worked with Derek Oneness, and eternally grateful to Gordon Brown for that opportunity. I think it's really important to recognise that that was a seminal moment in health policy and a seminal moment actually for government in focusing on the longer term, recognising that if we want an NHS that endures, we need to have that really strategic long-term focus and invest in the fundamentals. But where we are now is a situation that is worse than the situation when Derek Wanless was asked to look at the NHS. And actually, although in things like smoking we've made more progress in other areas, if you think of obesity, mental health that was mentioned, we're actually going backwards. And we're in the shameful position now that women in the most deprived areas of this country, in lower socioeconomic groups, are seeing their life expectancy falling, not increasing. And that any society in the 21st century can be in that position. It is utterly unacceptable. Actually, governments of all persuasions believe that prevention is better than cure and talk about the importance of prevention. Health policy in many ways actually is an area that has more in agreement than in disagreement. We want a service that is more preventative, that is not a sickness service, that looks at empowering people, that focuses on earlier detection, that talks about what's called the left shift towards more primary care, less hospital care. Despite that being actually a common and enduring thread of health policy for decades, the reality is actually that we spend less on prevention now. We've cut the public health grant over the last decade by a quarter. We spend a lower share of our health budget on primary care. And so actually, if Labour were to be serious about this agenda, recognising that there isn't a large amount of money around, and actually the pressure on immediate need and the acute hospital sector would be greater now than it was under Wanless, what could it do? And I argue that what it needs to do, certainly in a first term, and I think you can only think about the NHS and recovery and social care if you take a 10-year time horizon. But in that first term, I argue, and I am an economist and a former Treasury official, so I'm sorry, money isn't everything, but actually money does matter. So please bear with, I don't think that money is everything, but money does matter. That actually what Labour needs to do is to really prioritise in funding 3 areas. The first is prevention, and I've done a work with Demos over the last year arguing for a new category of public spending. We have a capital spending category that we protect, and government and public services aren't allowed to raid the capital budget for day-to-day spending. We recognise spending on capital is different to day-to-day. I argue that's important, but actually prevention is another form of investment, and we need to create a new category of public spending, which I call prevention DEL. DEL is the Treasury jargon for type of public spending, that we create a new category of prevention. We make it clear and transparent what we're actually spending on prevention, and that what we should do in a first term is legislate a commitment to increase progressively that spending on prevention, making it harder to raid the prevention spending when there's a day-to-day pressure, but also creating a mechanism to get accountability, but also credit for when you do the right thing and have that focus on prevention. Equally, I think we need to make sure very clearly and think through how we can protect spending on primary care. It's very noticeable that over the last decade, spending on primary care as a share of our health budget has fallen. And yet what we've done looking at what are the pressures on the health system over the next 10 to 15 years shows that there'll be 2.5 million more people living with major illness over that time period. 2.5 million. Much of that is a rise in mental health and chronic pain. It's among people in working age as well as the elderly. That is a drag not just on the quality and experience of those people's lives. It's a social justice issue, it's a driver of inequality, but it's also an economic issue. We will not get economic growth and prosperity where people cannot work and fulfill their potential. So actually, it isn't that economic performance and social justice are in conflict. Beatrice Webb, I think, would have understood this. They go hand in hand. What's right for people, what's right for justice is right for our economy. Yet there isn't a trade-off in that. But those conditions are actually conditions that are primarily managed in primary care, not our acute hospitals, and we need a flourishing primary care system. And then the third thing where I really agree with Wes Streeting on this is we need to modernise our NHS, and for that we need an investment in the buildings, the facilities, the access to modern diagnostics, and we need to embrace the 21st century, bring the health and care system into the future, allow them to harness the power of new technology and data, join up care and digitise our system. And I think if we focus on those things, we will have the possibility then in a second term of radical improvements in day-to-day care, but they do require an honesty with the public. A waiting list of over 7 million people will not magically disappear. Services will not be transformed overnight. If we hold our nerve and invest in these key areas, though, we will be fixing the fundamentals that mean that then we can truly have a health service sustainably, which is fit for the future, delivers social justice, and contributes to economic prosperity. Thank you.
Amazing. Any excuse to promote Gordon Brown or to tell everyone how great he was is well taken, so big tick on that point. And I guess an upside of opposition is you don't hear about the Treasury jargon, but I've got bad news for the panel. If we're going into government, which hopefully we are, you'll be hearing a lot more Treasury jargon, and I think it's going to be, as you said, it's going to be a lot of jargon a lot of the time. I'm going to ask the doctors in the House, I'm going to ask for a couple of brief opening statements, and then we will go to questions, and I am aware of the time. When you're ready.
Thank you. So I'm going to start by telling you about a shift that happened actually a few years ago now, but it's just one of those that's stuck in my head. So I was working in the hospital. We had a young boy brought into hospital by the ambulance. He'd had an asthma attack at home, so we tried to resuscitate him in our A&E department, but he'd been in respiratory distress for too long, and this young boy died in our A&E department. Now, asthma deaths are deaths that shouldn't happen. The vast majority of asthma deaths can be prevented. Yet in the UK, we have one of the highest asthma mortality rates among children and young people in Europe. So I mention this case because I think it reflects what's going wrong, not just in our healthcare system, but also in wider society, and why we're becoming increasingly sick as a society. So from a healthcare point of view, we're just not getting the basics right. So if you look at the young people that died from asthma, nearly half of them hadn't received adequate care when reviewed. We know that kids are not getting their checks done in primary care. We know that secondary care, so specialist services provision is patchy, dependent on your postcode, and over half of the children that died were not under specialist care. We know that 77% of children that died didn't have a personalised asthma care management plan, something that all children should have. And there's many, many other things that I could talk about where things are going wrong. But then we also need to look at outside of the healthcare system. So in recent years, we're seeing more and more children being admitted to hospital with respiratory problems, with breathing issues. And this is in large part due to the fact that we have more children in this country living in poverty. So who are more likely to be living in damp, cold housing, who are more likely to be malnourished, who are more likely to be exposed to higher levels of air pollution. And as a result, if you're a child living in deprivation, you're 2.5 times more likely to be admitted to hospital with an emergency admission for an asthma attack, just like that child. Now, that should touch all of us. That right now in our society, we have children, for no fault of their own, who are more likely to get sick and who are more likely to die as a result of the conditions that they're living in. So going forward, we have to get the basics right, as Anita said, in our healthcare system. We need to, I'm talking about staffing, I'm talking about capacity, taking our NHS out of firefighting mode that it's in, so it's able to modernise and able to innovate. But we also do need to think about how we can do things differently. So, as everyone said, what does holistic care actually look like practically? And what are the resources that we need to deliver that? What are the things that we can look at outside of the healthcare institutions? So leisure centres, community centres, how can we utilise those to better support people with less resources? What are the tools that our healthcare professionals need and the resources that they need to actively identify and support those with poor health? How do we address the inverse care law? So by that I mean that areas we have right now in the country, areas with greatest need tend to have lower levels of care provision. So what are the specific policies and incentives that we need to introduce to address that? And finally, the party also has to be bold. And I think the party cannot shy away from using legislation to address these structures in our society that are making people sick. So whether that's initiatives to improve air quality, whether that's legislations to ensure that we have healthy homes, whether it's using our taxation system to improve the quality of our food. And yes, I'm sure we'll get rants in the Daily Mail calling us the nanny state and all that, but right now we are a sick state. Yeah, as others have said on the panel, we are getting sicker at a younger age. Maternal mortality is at a 20-year high. Infant mortality went up last year. And I just want to leave you with this quote that I really love from Raymond Williams. To be truly radical is to make hope possible rather than despair convincing. So we have an opportunity here, not just to rethink about how we deliver healthcare, but to rethink what it means to live in a healthy society and what good health means. And I think it's up to all of us today to take up that opportunity.
Amazing. Thank you so much for those important words and solidarity with you and your colleagues who are on the front line dealing with this and have been for years and years and years without any support or anything from the government apart from a clap once in a while, which is so far away from what you actually need. Now we go on to the best part, which is Q&A. Just a couple of things. I will take them in groups of 3. We will then do a Boris. We'll start right, panic, and then go left. In terms of answering, I will ask for a woman to ask, or somebody who doesn't identify as a man, to ask the first question. And I will try and keep it balanced if I can. Please make them brief, and I will cut you off if it is too long. I'm really sorry. I actually just will cut you off. Brilliant. Okay, I'm going to start with the woman down there in the grey blazer jumper. You got it. You look great.
Hi, Jane Morton. I'm an architect. It's really good to hear the word prevention being used by quite a lot of the panellists, and also sort of touching maybe from what Sonia was saying. Our urban environments can actually really, really affect our health. It can make us sick due to poor air quality, lack of access to green space, also loneliness as well is a real issue. So my question is, what can Labour's plan be, or is there a plan to work across departments, not just in the Department of Health, to have a strategy to retrofit not just our buildings, but also our towns and cities to create healthy neighbourhoods that would improve health outcomes across the board?
Brilliant, and brief as well, which we love. I'm going to ask for the man in the maroon sweater. Doing an impression of David Dimbleby. I'm not too sure it's working. Not too sure it's working, but I'm giving it a go.
Hello, I'm Steve Bradley. I'm a GP. I work in Leeds, and one of the really frustrating things now is these issues around drug supply. So a while ago we had a scarlet fever outbreak, and there was no penicillin, which is crazy. And recently we've not been able to treat scabies with the one treatment that's available called permethrin. Like, to me, that's the absolute pits of clinical care. Should we be thinking about getting some generic manufacture of these drugs so that we can make these ourselves and give people jobs as well? And secondly, if I could just highlight an excellent pamphlet the Society did a few years ago, Prescription for Fairness, which addressed a lot of the health inequalities issues. Anita did a wonderful chapter, and also a really good chapter in there about how we talk about health inequality so it doesn't sound like nanny statism. Thanks.
Brilliant, thank you. And then I'm going to ask the woman in the far left, not a reflection on your politics, obviously, in the purple jumper, I'm hoping. Maybe it's a bit more pink.
Jane Roberts. I worked for many years in the National Health Service in secondary care. clearly there's a huge amount to do in healthcare generally, in the NHS and but I wanted to ask a question about policy to Abina, and the same question about the economics of it to Anita. Three things. One is I strongly agree with Anita about the importance of primary care. I didn't work in primary care, but it seems to me absolutely crucial, and particularly continuity of care, popular with patients, and a lot of the evidence is that it can be, in the long term, cheaper as well. Secondly, the importance of Sure Start, whatever you call it, whatever new name you might have for it. If you're serious about prevention, if you're serious about long-term health and well-being, all the evidence, long-term evidence coming out of the Institute of Fiscal Studies about Sure Start. And thirdly, about a really simple thing, walking. The simple act of walking as a mode of transport. A nice quote is that walking is the best buy in terms of public health. And in order to do that, you need to encourage people to walk more as a mode of transport from A to B, children walking to school more, and secondly, improving the walking environment, making it safer and more fun and attractive to walk. Now, so my question is, on policy terms, the degree, I mean, because it's all about priorities, and there are so many priorities, I get that, but in terms of where those three things lie, in terms of a future Labour government, but then secondly, in terms of the economics and the modelling, which you touched on, Anita, it's just whether the Treasury currently has the means by which to estimate those costs, and secondly, is there the official and political will in order to do so?
Brilliant. Three fantastic questions. As I said, I'm going to start with the doctor in the house, and then we'll move on through the panel.
Okay. I'll maybe take two of the questions.
Go for it.
Yeah. So your question, I think I completely agree, and I think the question was what Labour Party is going to do. Well, maybe what I would quite like to see is thinking about, because as you said, a lot of these policies are not actually to do with the NHS. So maybe we should be thinking about whether is it possible to have, let's say, well-being or good health as a policy, as a priority that needs to be done through all policies and through cross-government. So whenever, let's say, a minister for, I don't know, comes in with a new idea, then you've got to look at it through that health and well-being framework and say, does this policy improve that, yes or no? And then having that as a cross-government thing. I also think that this is a real area where actually locally you can make a real difference in local government. And there's different councils, mainly Labour councils, doing some really amazing work on this, so thinking about how they can, but I do think that needs to be done when you see councils doing good work, thinking about how that can be upscaled throughout the country. Right now in our area, we're really trying to improve the links between primary care and the voluntary sector, but also private sector as well, like leisure facilities in the area. Thinking about how that can be done throughout the country is really important. Towards your question, I know you had a few points. I really agree with that primary care, continuity of care is really important. So sort of 20 years ago, when you come to your GP, you would have your own GP, your GP would know you, would know your issues. That's in a lot of GP practices doesn't happen. It happens in my practice still, but it doesn't happen in a lot of practices. And I think we need to be mandating that you can see the same GP so you get that continuity of care. But I also think we need to think about that what we're seeing now as GPs is different to what we saw 20 years ago. People are more complex, people have more health issues. And I basically have about 8 minutes per patient, which is just not long enough for many people that need more care. So thinking about how we can have a bit more flexibility in general practice to provide better, more holistic support to people is really important. And then, like Sure Start, also thinking about, so in my area, I work in Tottenham, and we have a real issue with, I see a lot of the women in my practice, and you have women who have young children or pregnant who don't have actually family support around them. Just basics of how looking after a baby they don't know. So thinking about, but then also they're struggling with things like, I had a woman last week who came in, just had a baby, she's got some awful things going on in the house. She doesn't have time to chase up emails, do all the things to try and get the building work sorted in her house. So having maybe centres, whether that's in the primary care or other places where we can support these women with their health needs, but also with their social needs, and then giving them that time to educate them on how to look after their children, but also to try and support them in all the other things that impact health. Having those places to do that, I think would be really useful. And then your point about medications, I completely agree. I think a lot of people don't realise this. it's absolutely ridiculous. In the past few years, we just don't have medicines. You know, I prescribe something to someone and it's just not there. I'm not actually sure whether it's to do with us coming out the EU or what the actual problem is as to why we're having all these medicine shortages. But it is quite serious when we're not having certain antibiotics to treat conditions. I'm not sure about the logistics of us producing our own, but it is a problem that's getting worse in the past few years, and could potentially become quite dangerous. Like right now, I think ADHD medicines we don't have, so so someone can just go months without having their medicines, which is really important. So I think it's an issue that hasn't really got to the news yet, but it's becoming a worsening problem.
Wow, that is completely unacceptable. I know you kind of just mentioned that, but the fact that we live in one of the richest countries in the world and we don't have medicine for basic things, I find to be scandalous.
For ages, we didn't have a lot of HRT medicines. So, women just didn't have HRT.
Remarkable. Sorry. Take away from your point.
Yep. Thank you. Just going back to your point, Jane, about Labour's plan to work across to create healthy outcomes. As I mentioned earlier, we've appointed Luciana to do a cross-government review, which would look across departments. So that would also include things like urban planning. I agree with you about things such as, walking and the environment's important. Yesterday, I did a ribbon cutting in my constituency with Woodlands Walk, which was set up by Goldie Lee's Trust, which is part of Oxley, which is work they are doing proactively to look at how they can use green space to help people with their mental health. And they're also looking at how mental health wellbeing centres could be created. I know there's something like that that's really done in Bristol. So it's also, I see us working in collaboration with areas such as NHS sector and other departments and organisations and groups that are already proactively doing the work in terms of looking how locally they are meeting the demands of people that need the support in that aspect. Steve, first of all, I want to say thank you for what you do, along with other GPs and other people in this room that work on frontline services. I know you're under extreme pressures at the moment and you're not always thanked. So I hope you feel that we're not bashing GPs, particularly with our messaging, and I know that's something that's really important, how we address that. I think that we also need to look at how deals the government strikes with pharmaceutical companies. Because I think there, as you've mentioned, particularly with the drug supply shortage in scabies, and you've also mentioned the HRT supply, we need to really review that kind of aspect. And I don't really see any leadership currently from the government on that aspect, particularly when I've raised things, particularly with regards to HRT supply. We know at the moment there is a real breakout with scabies, and the government have been very silent on that, particularly in notifying us what action they're taking on that aspect. Jane, your bit about prevention, that really, I think essentially you're trying to say, you want to hear more, I guess, from us in terms of what we're going to deliver correctly, if I've heard that. I think the Sure Start that we implemented was great. It was ambitious, and we need to be looking at how we can implement something ambitious of that scale. And walk-in is important, as I've already answered in relation to Jane. But also, I think it links into the work that Luciana's doing in terms of the review, in terms of urban planning, and also how we could use transport on that aspect. I'm not sure if I've really answered your question properly. I think I've covered it, but I'm not sure. If I haven't, please let me know, and I can answer it clearer.
I think you've nailed it.
Right, okay.
Some credit to you. And obviously, on behalf of the panel, just to say thank you for not alone what Dr. Asera is doing, but also for the gentleman in the maroon jumper is doing.
Sorry. Yeah, I forgot to mention something else.
That's all right. Would you like to mention it now?
Yeah.
Go for
I also
it.
forgot to mention the Child Health Action Plan, which was announced by Keir recently. We've put tangible outcomes in terms of what could be used to address things, to look at earlier prevention, particularly with children. So that's a good... Pardon? That's correct. I mean, as I mentioned, there is a review being carried out at the moment in terms of looking across the departments. I was just giving you an example of something that we're looking at in terms of early prevention when it comes to young children, but I will feed that back.
Brilliant. And then just to, your answer to the question.
A couple of points from me, and it's lovely to see some old friends here. I think the drugs issue is an interesting example of something that's happened over the last 20 years that COVID really shone a light on. We've prioritised short-term efficiency defined as lowest cost over resilience in our system. And so all of the sort of approach to supply chain and other things have got out of whack there. So I don't know if building our own generic capacity is right. What I do know is I think one of the lessons I think that will come out of the COVID inquiry, which is one of those quiet but really quite important technocratic structural changes to government, is we need to find a way of assessing not just what's the cost and impact on delivery of services today, but have we actually got resilient services? And all the evidence on climate change and everything else is, when we see it with floods, it's not just health, is that we're going to be a society where we have more of these extreme events, more volatility. You know, what's going on in the Red Sea at the moment disrupts the supply chain. So having a more resilient society, more resilient infrastructure seems a really important thing. And so we need to be able to look at policies, to look at our approach to things like the way we source drugs and all of that in the light of that. And I think the immediate drugs issue is, but being someone who spent Friday going to 5 pharmacies to try to pick up a fairly standard medication, I'm very aware of your point. I also thought the other thing I pick up on is, so there are 2 other kind of government infrastructure, and I say these because when you come in, if you're a new administration, you know, you get a short opportunity actually. I mean, not just to do your immediate policies, but to try to bake in some different ways of doing things, which actually are quite important in the long term. So I think that about balancing the short term with what we're doing with resilience as one. We've talked a lot as an organisation about really ensuring across government that we have a health in all policies approach, and we think about appraising that and build that in to the way the government does it and at all levels does its work. And the third thing, which I've started to think about with this work on this idea of a new category of public spending called prevention public spending, PDEL, is you could start to see that as an investment. And in the Treasury's work and in the Office of Budget Responsibility, which does all the assessment for that, you can start to think, when we invest, is there a longer term return to that? And can we capture that so that we're not just scoring the spend today, we're actually thinking about the benefit that that produces in the future and changing some of the mindset around that. None of that is a quick win. But actually, what's wrong today is not just the immediate policies. It's that in all of these really fundamentally important building blocks of a flourishing society, we've become addicted to the short term, and we need much more of a long-term systematic focus. And you can talk about that for climate change, for health, you know, all areas of what's happening with children and education, all of those areas of society. And we will need to change and transform a lot of the way the actual undercarriage of boring technocratic government is done if we're actually to shift that.
Brilliant, thank you. And last but not least.
So I think there's huge agreement across the panel and in the room that we can't go on like this, and we have to have that shift to prevention. But as Anita said earlier, if it was that easy, we'd have done it. You know, people have been talking about this for years. I think that points made by questioners are absolutely spot on Sure Start and you know, investment in early years inequality, and the returns couldn't be more obvious, and it's something that we haven't as a party got enough policy on at the moment and should be a top priority for the first 18 months of a new government. And similarly with use of space and transport, where actually I think Labour does have a really good record at local and regional level. I mean, with Sadiq's speech earlier, what an awful lot of Labour local authorities are doing to change how land is used, to decar road use. So lots to do, but it needs to be on a bigger stage. Plug for Louise's session later. Make sure you go to the transport session if you into that. But in terms of like sort of the structure, like sort of to what Anita was saying, we need to be really clear what, as a government, we're trying to do and have some new mechanisms to achieve it. I really like what you just said about that prevention DEL. In the social care proposals we made, we said there should be a top slice that goes on open access preventative services before you're assessed as needing support. And basically that's a mini version of a policy that you're calling for across public services. I spoke earlier about social care, about allocation of funding around the country, but that's a critical issue across public services. The Tories have stripped money out of poor communities by playing with the formulas over the last 15 years. We've got to put it back in. We've got to change the allocation of resource so that poor communities get what they need. And then the final thing I'd say on the sort of structure is we need to have the right big 10-year missions that focus us on that. And we haven't quite got it right on the health mission yet, because it's mainly an NHS mission that talks a little bit about health inequalities, but actually we need to flip that and say that our mission is healthy life expectancy, and with some, some follow-on sort of more detailed healthy outcome related measures that you hold yourself to account on over 10 years. I know we talk about the NHS all the time and waiting times are completely front of mind, but if we want to reset how government works, you have to start right from day one and say it's about health outcomes.
Brilliant, thank you so much. Unfortunately, we are over time. What I'm going to do is just ask all our panellists to give a 1-minute summarisation or conclusion to their thoughts and what they think a Labour government can realistically do in the future in the hopes that we get one this year. And it is, of course, worth saying that without organisations like the Fabian Society, we will not have a future Labour government, because it is the ideas that are created in rooms like this and the discussions that we're having now that provide the policy that takes us forward. So on that, I'll start with Dr. Edasera.
Yeah. I guess we're all saying the same thing. I think the room and the panel are in agreement. I'm excited about what a Labour government can do. And I think, the message is the Labour government is not going to just change our NHS, but change what it means to be healthy in our society. And it's not going to be quick, it's not going to be easy, but also I think it's something that's going to need us to be thinking out policies outside of the box. And I'm sure in the audience we have people working in lots of different areas, different sectors in local government. And I think it's all of us thinking about what we can do, to thinking about how our society can be healthier, is what will lead to those improvements that we want to see, and a reduction in the widening of health inequalities that has happened in the past few years under the Tory government, which is unacceptable. I think that's something that we have to really go home with. What's happened in the past few years amongst health and the health of the poorest in our society is completely unacceptable, and now it's up to all of us to address that.
Brilliant.
I say this is a great opportunity to put everyone's health first. We've had 14 years of a Tory government, so the challenge is going to be quite high for us. But I think that we are viewing things in a very different way. As you heard me in my opening speech talk about prevention, which is key. I also think it's an exciting way to look at how we can use technology to improve people's outcomes. But also, we also need to look at, when we come into government, how we need to change things really quickly in terms of inequalities such as cancer diagnosis, other diagnoses. We've already talked about things such as mental health hubs, mental health counsellors, midwives. But we also need to have a long-term plan, which is what we're looking at. But we do not know what we are going to inherit when we get into government. So we also have to operate in a cautious way, but in an ambitious way. I'm really excited to be at the Fabians, because I know that the Fabians, a lot of you have a lot of great ideas, and a lot of it has been the basis for where we've looked at how we've shaped part of the mission as well. So as a Fabian member, I'll be working very closely with you.
Brilliant, thank you. And just briefly, Anita.
So really, focus on 3 Ps: prevention, primary care, and investing in the progress in the modernisation. Can't do everything, but actually focus on fixing those fundamentals that I think will unlock the sort of outcomes that we all want.
Oh, amazing, how brief. Oh, points to you. And for final, last but not least, Andrew Harrop.
As Abena mentioned at the start, it was Fabians who first proposed a national medical service. We, in this incoming Touchwood Labour government, need to complement it with a national care service. We've talked hugely about prevention and public health, and health inequality is not just about healthcare today. All of that is rooted in the most classic Fabian concern, which is inequality within our society. And none of this will start to happen unless the next Labour government is focused from day one on poverty and inequality, which is the driver of health. And that means brilliant public services, but it also means reforming markets and reforming tax and benefits so that we reduce poverty and inequality.
Brilliant, thank you. Thank you very much to our panellists, Anita, Dr. Sonia, Andrew Harrop and Abena. I've been Kathleen, you've been amazing. Thank you very much.
Thank you.